Robert.
78 years old patient diagnosed with dementia, renal impairment, history of recurrent UTI. Persistent baseline was creatinine 250. Now the patient has been presented with UTI, nausea, vomiting, bloods, potassium is 8 millimole, sodium is 121, creatinine is 700.
Now, can you interpret
Mm.
what is going on in this scenario? Can you interpret the finding?
Okay, sir. The patient is having acute kidney injury on pre-existing renal disease.
Okay. So it may be what the patient is having 78-year-old patient, okay, and he's
Yeah,
having which kind of
uric creatinine is 250 also, and
obstructive
recurrent UTI.
uropathy. Correct, the obstructive uropathy because of old age. It might be the benign prostatic hyperplasia. Remember,
Yes, sir. Yes, sir.
and the problem is the pre-renal due to the decreased oral fluid intake is the patient is dementic. Okay. So now, what is the
Yes, sir.
pathophysiology? Or you can tell
Okay.
me this this patient urinary catheter is inserted. It drains 1500 ml of the fluid, then 4 liter per day. Why?
Yes, sir. It is actually a diuretic phase of AKI in which there is a um, uh, in which the glomeruli are functioning normally and it filters the blood, filters the water, but the distal tubules are not functioning properly, so the water is not getting reabsorbed. So, uh, the catheter has drained 4 liter day later.
Okay, so
Okay.
during the recovery, the glomeruli will recover first, so it will increase the glomerular filtration rate. But the distal part of the tubule is also affected, which is not yet recover,
Yes, sir.
and low reabsorption, so the functionality has been decreased, and that's why the patient is having increased amount of urine. Very good. Tell me about the patient is uremic.
Yes, sir.
Why the uremic patients are anemic?
Okay. In uremia, there is a decreased synthesis of erythropoietin and hence decreased RBC synthesis. And also, the urea toxins they destruct the bone marrow cells and leads to fibrosis. And also, the toxin also causes hemolysis of the RBC itself,
Okay.
so causes anemia.
Well, what is the function of potassium?
Potassium in body helps in nerve conduction, in cardiac activities, uh, and in fluid acid-base balance also.
Okay. Uh, Tell me the hemostasis of potassium. What are the factors for the hemostasis of potassium?
Okay, potassium level is maintained in body with the dietary supplement and requiring the minimum dose is 0.5 to 1 milli equivalent per kg requirement, and endocrine function which is carried out by aldosterone and insulin. Renal function where there is acid-base balance, so the hemostasis is maintained.
And tubular
Homeostasis.
fluid flow rate, correct?
Yes, sir.
So if the tubular flow is more, what will happen?
Tubular.
If the tubular fluid flow rate is more, there will be increased flow promotes potassium secretions. Okay, there will be a
Yes, increased potassium secretion, hyperkalemia. May
hypokalemia.
lead to hypokalemia is
Yeah,
it is excreted.
very good.
Yeah.
What is the action of potassium on the cardiac muscles?
So in cardiac tissue, it leads to the uh, it leads it causes the heart to become flaccid and it leads to the bradycardia.
Okay, can you tell me the mechanism behind this, or can you tell me the uh, effects of potassium on the heart for surgical practice?
Yes, sir. This effect of potassium in heart is used as a cardioplegic agent. Potassium-rich cardioplegic agent is instilled during the cardiopulmonary bypass during the diastole, and uh, it is the cardiopulmonary bypass is taken
What is the mechanism
undertaken.
of cardioplegia?
We so
So, okay,
we arrest the heart at diastole, and we transplant,
okay,
or
very good.
we
Normally, remember,
okay.
normally the resting membrane potential for cardiac myocyte is minus 90 millivolt, but in hyperkalemia,
Yes.
it will interfere with the resting membrane potential and become more positive, like it will be minus 70 millivolt. So the overall action potential will be delay, and if you keep increasing the outside potassium, it will lead to arrest or stop the action potential. Okay, that's how the
Yes, sir.
potassium arrests the heart, and that's the action of plegia. Now, tell me, what are the manifestations of hypokalemia?
So the manifestation of hypokalemia in cardiovascular system, it causes the narrow QRS complex and inverted T wave arrhythmia in ECG. Also in musculoskeletal system, the hypokalemia causes lethargy, and in central nervous system, it causes confusion and paralytic ileus also.
Yeah, very good. Muscular weakness and cramps also mention it. Now tell me about
You
the
can you asked me about hypokalemia, right? Or
yeah,
hyperkalemia?
hypokalemia.
Okay, okay, right.
Okay, what are the manifestations of hyperkalemia?
Okay, so in cardiovascular system, there is there is a decreased action potential. That's why there is wide QRS, and also there is tall T wave, and there might be a cardiac arrest, and in musculoskeletal system there is a increased muscle activity and cramps. In central nervous system, the patient might be restless or agitated. Also, in GI, there might be increased GI motility, and nausea, vomiting, diarrhea might occur.
Okay, what is the emergency management of hyperkalemia? This is very important. Okay.
Okay, sir. So I will manage this patient according to the care of critically ill surgical patient protocol, following ABCDE. And after stabilizing the patient ABC airway and breathing, I will first monitor the cardiac activity of the patient, and will stop any potassium infusing solution, and instead of that I want to give a 10 ml of 10% solution of calcium gluconate in 10 minutes. Also, along with that, I will also like to administer the insulin, with along with dextrose, and also salbutamol can be given. And for the patients, um, there I can also go with hemodialysis if the pH is less than 7.1,
Okay,
and if he is acidic, then I can also give a sodium bicarbonate solution.
very good. If hemodialysis, if a potassium is persistently high and if there is severe acidosis, okay. Now you can also use the
Yes, sir.
calcium resonium, correct?
Oh, yes, sir.
Okay.
Reasoning.
Now, what are the ethical issues of a dialysis of a 77-year-old man with dementia?
Yes, sir. So, as the patient is not capable of signing any consent, I will like to sign the consent form 4 with my two consultants.
Okay, by taking the signature of two consultants or the consent form for. Also, you involve the
Yes,
staff of his residency, okay, or special nurse.
yes, sir.
Okay, very good. Now, about this station, I think you covered the whole things here, and I think you miss one thing here, which is the what was the question that you said? I'll come back. Okay, so almost we covered the whole thing. Okay.
You said about that depolarization, which that after due to hyperkalemia, the negative potential will, like normal negative potential is 90, right? So it will raise to minus 70, and there will be less depolarization of the cardiac muscle.
Yes. So the
Okay.
depolarization will delay. Okay. So if there is the
And also
depolarization,
repolarization time will also delay because there
yeah,
is more potassium.
yeah,
Okay.
yeah, yeah. So